Good morning friends. Today we will discuss about what sperm cryopreservation is. Basically, sperm cryopreservation is also known as sperm freezing. Here we freeze sperms in liquid nitrogen at -196 degrees Celsius, which we can use later on for fertilization of an egg. Cryopreservation is a term which is used to describe the process of freezing and storing sperms, eggs, or embryos for in vitro fertilization cycles. Cryopreservation, we can store sperms, oocytes, embryos, or blastocysts in the liquid nitrogen. There are two methods. There are two methods at present which we use for freezing in an IVF labs. First is slow freezing and the other one is vitrification, which is also known as ultra rapid freezing. Vitrification is the process of converting something into a solid without any crystal formation. Here, a cryoprotectant is added to the semen to control sperm damage, which is caused by freezing. Cryoprotectants are low molecular weight and highly permeable chemicals which are used to protect sperm from freeze damage by ice crystallization. It is done by adding a cryoprotectant. This is important because ice crystal formation can be very damaging to frozen embryos, sperms, or oocytes. Sperm freezing is useful if a person is facing a medical treatment for any condition, that is like if he is having cancer or anything, then he earlier freeze the sperms. Is having about to have a vasectomy, if a person is having a low sperm count or the quality of the sperm is very bad, then we do freezing before his starting the cycle. If he is having a difficulty producing the semen on the day of the fertility treatment, then also we are telling them to give the sample and we see the count and then we freeze previously. And if there is a risk of injury or death, then also some patients are freezing their sperm sample. How sperm cryopreservation is performed. The freezing of sperm needs cryoprotective agents that minimizes damage to the cells during the freezing and thawing process. Now there are cryoprotective agents. One is permeating cryoprotective agents which penetrates the plasma membrane. The other one is non-permeating cryoprotective agents which unable to penetrate the plasma membrane. Cryoprotective agents can be toxic if they are used at a very high concentration. Permeating cryoprotective agents such as dimethylacetaldehyde, dimethyl sulfoxide, glycerol, glycol, ethylene, and methanol. This stabilizes plasma membrane proteins and reduce concentrations of electrolytes. The non-permeating cryoprotective agents such as albumins, dextrans, egg yolk citrate, hydroxyethyl polyethylene glycols, polyvinyl pyrrolidone, sucrose. They minimizes intracellular crystallization by increasing viscosity of the sample. The most commonly used cryoprotective is glycerol, which is mixed with egg yolk, which reduces the incidence of osmotic stress within spermatozoa. Sperm freezing has been done successfully since 1953. It is a highly effective process for people looking to preserve their fertility. Of course, some sperm don't survive the freezing process. The thaw survival of sperm is over 50%. Benefits of cryoprotectants. They maintain the sperm viability, means they maintain the sperm motility. They improve the recovery of motile sperms by use of zwitter ions buffers that has been attributed to their ability to bind free hydrogen and hydroxy ions in the surrounding medium. They improve sperm membrane fluidity. They increases sperm longevity and percentage of survival. They increase ability of sperm to penetrate cervical mucus post-thaw. Sperm freezing measure. They are developed to maximum sperm survival and to maintain DNA integrity and function after cryopreservation. It is egg yolk free and contains only chemically defined components including glycerol and sucrose as a cryoprotective agents. They contains both glycine that improves post-thaw sperm motility, membrane and acrosome integrity, and SSR with insulin shown to be a pro-surviving factor. Before storing the sperm, there are various steps that are the patient needs to go through careful screening for triple H. Nowadays, COVID was also there, so we are sending the patient for doing their COVID test also, VDRL test to avoid chances of infection. If without testing these blood tests, if we will store, then it will affect the other samples also which are frozen. The patient needs to give a written consent regarding what will happen to his sperm, whether anybody can use your sperm such as your partner or for research, or if it can be donated for somebody else treatment, and how far long the person wants to store his sperms. Mean every center has their different protocols and different charges for freezing the sperm's embryos at different amounts. The standard time for storing a sperm is 10 years, but the patient can extend the storage time up to 55 years. Before sending the patient to the giving sample, we should see carefully the blood tests, everything, and then we are giving them a consent form to fill for freezing their sperms, in which they have to write their husband name, wife's name, date, their mobile number, the proper address, and we are also taking the witness, the person who is taking the consent form. How is sperm collected and frozen? Sperm, basically the reproductive cells found in a man's semen. It is typically collected through masturbation. A man can choose to collect his sample at home or in the clinic, but should use an approved sterile lubricant that doesn't harm the sample quality. Men are also asked to abstain from sexual activity for approx 2 to 5 days prior to the appointment to allow for the best possible specimen. Once a sample is provided, it is being sent to the andrology lab, and the embryologist or andrologist check the sperm count, motility, viscosity, everything, and then they use it for the further processing for the semen freezing. Here shown after the collection, they dilute the sample, then they add sperm freezing media, and after that they are keeping it in the chiller for 20 minutes. After that they are keeping it, after 20 minutes they are keeping in the liquid nitrogen vapor for 20 minutes, and then immediately after completing the 20 minutes in liquid nitrogen, then they are just storing it in the liquid nitrogen containers. In these we need a straw holder, which is also known as aluminum cane. Straws basically we use for sperm bank. Some sperm banks use straws, some use the cryovials, the forceps, syringe tanks. Every institute has their different protocols and techniques through which they use their freezing. Thank you.